And I'm going to turn it over to Jen Lyle, our CEO. And once Jen's had the opportunity to share her comments with you, we're going to show a brief video, and then we're going to turn it over to our panelists, to Jim, Jerry, and Sana. And each panelist will have 5 minutes to answer a question. We've got 2 rounds of questions, and then we're going to open the floor to you, the audience, so we can hear your feedback, your comments, your thoughts, your questions. And please note that we're going to hold off on answering questions until we get to the end of the webinar, or the end of our session of the webinar, I should say. But we encourage you to type your questions into the chat if they occur to you as our panelists are speaking today. So I'm going to turn it over to Jen. Welcome.
Thanks, Heather, and thanks for the introduction, and thanks to everybody who's joining us here today on World Alzheimer's Day. I think it's particularly relevant that we're talking about age-friendly and dementia-friendly communities on World Alzheimer's Day, and it's so important, and there's a couple reasons why. According to the BC CDC, about 74,000 British Columbians are currently living with the diagnosis of dementia. Now, the actual number of people who are living with dementia is likely higher because we know people who are living with dementia likely have or often have difficulty accessing a diagnosis. So that's a significant number of people, but I also want you to keep this number in mind as well, and it's 6 in 10. Recent polling data conducted by Leger on behalf of the Alzheimer's Society BC found that about 6 in 10 British Columbians have a personal connection to dementia. So for all of you who are here on the call today, whether you know it or not, chances are you know someone who's personally impacted by dementia. The other thing that I want to share with you is that we know that the majority of people who are living with dementia, or people who are living with dementia and their family members, still experience a significant degree of stigma, and we still hold a lot of misconceptions and discrimination around the issue of dementia. And I have another number for you that underscores that, and it's about half. As in, about half of British Columbians believe that it is no longer possible to live a meaningful life once you have a diagnosis of dementia. And we know that's just not true. Just like we know that you can still live a meaningful life and use a wheelchair, that you can still live a meaningful life and have a hearing impairment or a visual impairment, or that you have something that means that you experience the world a little bit differently than maybe other people around you. But that doesn't mean that it is impossible for you to live a meaningful life. And so that's why conversations around age-friendly and dementia-friendly communities are so important, because to be honest with you, the reason why we either experience our communities in a positive light or a negative light has a lot to do with how our communities are designed. Or more specifically, whether or not our communities, our places, our spaces, our neighbors are equipped to be able to support the abilities we have to enable us to participate as full citizens in the communities in which we live, or on the flip side, take away from our abilities. So that's why conversations like today matter, especially on days like World Alzheimer's Day. And that's why I'm so thrilled to be here for the discussion and to hear from people like Jerry and to hear from people like Jim and Sana about what we can do, both within our communities more broadly, but as neighbors, as family members, and as friends, to create dementia-friendly communities. So again, thank you for joining us. Thrilled to be here. And I'm going to turn the mic back over to Heather.
Thanks, Jen. And we're going to start with just a very brief video, just to give you a bit of an orientation to dementia-friendly communities.
Did you know that more than 500,000 Canadians, like me, live with dementia? Or that 1 in 5 Canadians care for someone who lives with dementia? Like me, many people living with dementia still live in our communities after we are diagnosed. It isn't always easy, though. Often, we feel left out and worried about how we'll be treated by others. Sometimes people just don't understand what dementia is and how it affects the brain, or know what to do if we forget something or get confused. So they seem frustrated or dismissive, and sometimes the places we'd like to go are just more difficult to get around. I once got lost trying to find the washrooms in a restaurant, because of the loud music, poor lighting, and confusing signs. But it doesn't have to be like this. Everyone in the community can play a part in helping people living with dementia feel welcome and in creating accessible and inclusive spaces for everybody to enjoy. When our communities are dementia-friendly, people living with dementia feel less worried about how we will be treated and more confident about going out. Have you ever thought about what it would be like to live with dementia in your community or workplace? Is your community supportive, inclusive, and accessible for people living with dementia? Is it dementia-friendly in ways that let people stay engaged in community life? Would you recognize the signs that someone may be living with dementia and be able to offer the right type of support? Would you be comfortable talking to someone if you knew they were living with dementia? Would you know how to respond if someone seemed confused or had trouble expressing themselves? Are the businesses, organizations, and public spaces in your community designed so people can use them independently without getting disoriented, lost, or experiencing stigma because they are living with dementia? People living with dementia shouldn't have to work harder than everyone else to stay a part of the community. Wouldn't it be great if the neighborhoods and communities that we all share were dementia-friendly? Together with the Alzheimer's Society and community members like you, let's keep challenging the stereotypes and building a dementia-friendly Canada where everyone feels welcomed and supported. Take the first step and visit alzheimer.ca/dementia-friendly Canada to learn more about Dementia-Friendly Canada. You'll find lots of information, education, and resources to help you and your organization become more dementia-friendly members of your community.
All right, before you launch into the next video there on my screen playing in the background, so I want to bring on now our panelists for this afternoon. So I'm going to unpin Jen here, and I'm going to bring Jim Mann on. Jim is an ardent advocate for us here at the Society, and Jim lives with dementia. I'm also going to bring on here, if I can find her in my list. There she is, Jerry. I'm going to add Jerry Hinton. Jerry also brings lived expertise to our panel discussion today. Jerry was the caregiver for her late husband, Peter, who had dementia. And last but not least, I'm going to bring on Sana Aziz. And Sana, as I mentioned earlier, is our provincial coordinator of dementia-friendly communities at the Society. And so now that we showed you that video and gave you a bit of a brief introduction to dementia-friendly communities, I'm going to turn it over to our panelists so that you can learn a little more. And I'm going to start with Jim today. And Jim, our first question today is, what does a dementia-friendly community mean to you as someone living with dementia?
Thanks, Heather. It will still see me and listen to me, and friends who will still invite me for coffee. That is the kind of dementia-friendly community. That is my kind of dementia-friendly community, where I or any others living with dementia are not thought of as having lost our marbles. The dementia-friendly community recognizes that the people living with dementia still have a lot to offer their community, that people need understanding from their community, and I would add, a community that is open to learning more about dementia and engaging with the residents with dementia to overcome any preconceived notions that they themselves may have. Where community members delivering medical care are knowledgeable and person-focused, and who are not making assumptions of incapacity simply based on the word dementia on the patient's chart. Like the account I read a few years ago included in a thesis that the patient in acute care felt that because of the label of dementia, quote, he was viewed and treated as a subclass on the ward. The dementia-friendly community will pay attention to the physical environment for ease of access and, for example, tripping hazards are removed to make navigating neighborhoods a positive experience. That encourages business and community services to adapt and support people living with dementia by increasing awareness and understanding. This insight will arm their workers with knowledge about disorientation and how to identify and assist that person to keep them safe and on the correct path to their destination. One way to achieve a dementia-friendly community is to be open to including the lived experience voices. They are the people who can offer on-the-ground feedback on their neighborhood that in many cases is unique and helpful insight. To become dementia-friendly is to listen to the people living with dementia. As I prepared my remarks, I asked myself, why is there a hesitation by individuals to share their diagnosis of Alzheimer's or another type of dementia? When this is a medical condition, why do many people tend to keep their diagnosis to themselves or strictly within the family? Stigma of dementia is certainly one reason why, but fear is a big factor. The fear of rejection by the community, the fear of being othered and being easily dismissed by friends and the community. Empowering people living with dementia and recognizing their contributions will be confirmation of the community's efforts and desires to become dementia-friendly. And it will also reassure those people living with dementia that their community has their back. I want to end my contribution by quoting Dr. Jonathan Evans, a geriatrician who said in a video entitled Person-Centered Matters that dementia doesn't take away your ability to be a human, your humanness, and it shouldn't take away your humanity. On the contrary, he said, it often brings it out. Even though dementia is something that affects the brain, dementia does not equal or result in a loss of intelligence. On the contrary, people use their intelligence to overcome some of the impairments that dementia causes. He ended saying, while there are many losses people experience from dementia, dementia doesn't make you stupid. Dementia does not rob you of your ability to experience joy, to be happy.
Thank you, Jim. Jerry, over to you. So when you think about a dementia-friendly community, what does it mean to you, particularly with that perspective of a care partner of someone living with dementia?
Well, thank you very much for inviting me to participate in this forum. You know, for 24 years now, I've been associated with the Alzheimer's Society of BC as a caregiver to my husband, Peter, who was diagnosed in 1998 and died in 2008. And prior to that, as the executive director for the Office for Seniors in BC, I knew of the society through my connection to Barbara Lindsay, who was instrumental in the development of the society's initial strategic plan, and who was pleased to receive government support for their work and the acknowledgement for the strides the organization had made in advocacy and education. They were ahead of their time in those early days, and I think they now have continued to provide outstanding and excellent leadership in BC, across Canada, and beyond. And we have Jen Lyle now taking this all on, and I'm looking very much forward to having, I don't think another 24 years, Jen, but as long as I can hang in there. You know, my Peter and I were on a journey. It started with him saying that he was forgetting what he'd read the evening before, and I dismissed it as fatigue. A year went by, and then sailing one weekend, Peter was rummaging in the cabin while I was at the wheel. I called to him to ask what he was looking for, and he responded, "The depth sounder." My heart sank. For those of you who don't sail, the depth sounder is a piece of equipment that is fastened in place in the cockpit, so the person on the wheel can tell how much water they have under the keel so they won't run aground. I knew in that moment that my sailor had dementia. He'd been sailing since he was 10 years old. This is often how the diagnosis can be made. Something unusual happens to distinguish dementia from a simple forgetful moment. I think it's important to say at this time that I'm an old nurse and have had experience through my work over many years. And it did give me an advantage that many don't have when they come to this moment of a diagnosis of dementia. And that's even more reason for us to ensure that we've got the necessary supports in place to create a dementia-friendly community. So what does that mean to me? First of all, it means a network of friends who accept us as we are and include us in all the things we've always done. Together, honesty and openness are important. And so in that relationship, you can't hide it. And telling family and friends can actually help the process of acceptance and allow you to continue living life as fully as possible. Dementia-friendly also means planning in advance and being sure that in your communities of interest, that you have an understanding that you need to plan for things to keep your environment calm and free of frustration. Planning in advance for unusual events included for us a small network of close friends who knew they were on a list and were prepared to come anytime in an emergency. I needed that list when I fell and broke my ankle. When we started the call out, a friend showed up in about 20 minutes, stayed overnight with Peter while I went for treatment. Community support from friends and strangers is also part of a dementia-friendly environment. As time went on, I began to notice that occasionally friends would say, "Now, Jerry, if there's anything I can do, please just call." Well, I'm not likely to call. And so on one particular afternoon, when that did happen, I said, "I need a lasagna on Tuesday." There was a look of complete surprise on my friend's face, but I got the lasagna and I also got a salad too. If you are a friend or a support to a family caregiver, just offer something specific and special, and the day and time you will provide it. It was always such a relief and pleasure to have meals brought and muffins made. And so to move along, I think there are some other elements that are really important for caregivers, especially in this role that we play. Continuing communication is an important element, and recognizing and dealing with issues in a timely way is critical. Contacts with business and service agencies. Grocery stores were a particular challenge for us, and Peter, who was by nature and by profession a man in control, would find it frustrating, especially in narrow aisles. We decided we could manage if he took the cart and I would decide what went in it. One issue was meeting people we knew in the store, as he really couldn't recognize anyone. We developed a little game, and when anyone we knew came along, I would lean into Peter and say, "This is Susan coming down the aisle." And he could remember just long enough to say, "Hello, Susan, how lovely to see you. How are you?" And I will never forget Susan coming by me later to say, "Gosh, it's so great that Peter remembered me." Attendance at dentists and doctors' offices, banking and exercise facilities became routines for us, and staff in every environment tried to meet our expectations of understanding, patience, and dignity, and spoke directly to Peter and not over his head. Sometimes it required a little redirection, but the staffs were always willing to adjust, and in so many situations went out of their way to provide extra support. And finally, I want to say the relationship to the formal system in late stage dementia is such a critical element. The time came when I could no longer care for Peter at home. Our journey continued at the Veterans Lodge at Broadmead. I spent every day from 10 a.m. until he went to sleep. I was there to feed, bathe, be his companion, and generally live our life in a new and different environment for 18 months. This required negotiation, understanding, patience, good communications with all members of the Veterans Lodge team and other parts of the formal healthcare system. It was an essential element of a dementia-friendly environment for us both. My thoughts reflect a caring community of friends, efforts by so many to accommodate both Peter and me, the knowledge and support of the Alzheimer's Society who were with us from the beginning, businesses, government agencies, doctors, and local health and provincial long-term care services were all there to support. There was an understanding for our desire to choose the manner in which we would live our journey. This is what a dementia-friendly community can be, and we should strive to ensure that everyone with lived experience and their caregivers and families have the same opportunity.
Thank you, Jerry. And now I'd like to turn it over to Sana Aziz. And so Sana, what does a dementia-friendly community mean to you as someone who's leading the Society's Dementia-Friendly Communities initiative here in British Columbia?
Wow, this is a tough act to follow. Thank you, Heather, for the question. Thank you, Jim and Jerry, for sharing your thoughts on this question. It's always enlightening and incredibly important for me to hear directly from people who have lived experience. As I reflect on your answers, I think of the people in my life who have lived with dementia, and maybe the people that audience know, individuals who may be living with dementia that they have come across. What would be an inclusive community to them? And I think of what a dementia-friendly community means for me and how we at the Alzheimer's Society of BC can help make them a reality. A dementia-friendly community is one that focuses on stigma reduction and the inclusion of people living with dementia in the places they work, live, and play. Dementia-friendly communities are places where people living with dementia, their families, their care partners feel included, acknowledged, and supported. A dementia-friendly community can be a city or a neighborhood, a location within any of these places, such as a grocery store or a library. It could even be groups and service organizations such as book clubs or faith-based organizations that are working to create accessible and inclusive communities. In a dementia-friendly community, people are aware of and understand so that people living with dementia can continue to live in the way they want to and in the community they choose. Like Jim said, we know that too many people affected by dementia feel that society fails to understand the condition they live with and the impact it has on them. They report barriers to feeling included in their communities because people don't understand how to interact with them. This often causes them to withdraw from community interaction, resulting in diminished quality of life and loss of personal connections. This is not okay. People living with dementia still have an incredible amount to contribute to their community, and Jim joining us here today is a notable example of that. They shouldn't have to work harder than others to continue living and being a part of their community. I envision a dementia-friendly community to be a place where people living with dementia and their care partners can freely carry out daily activities, be social and active, and meet fewer barriers and less stigma than they would experience otherwise. Speaking to Jerry's experience, I'd like to see an inclusive community where friends are there for their friends or neighbors who are affected by dementia. They don't withdraw. They continue to reach out, invite them to coffee, go out to play golf, offer to bring lasagna, or show up at a 20-minute notice when a friend needs them. A community where municipalities, service providers, and businesses take the responsibility to do their part in creating comfortable and welcoming spaces for all. Everyone has a role to play in helping make their communities become dementia-friendly. As we work with various municipalities, businesses, service organizations across the province, we recognize that dementia-friendly communities may mean different things to different groups. We also recognize that a place may never completely be dementia-friendly because each individual's journey is unique. However, there are a few key components of being dementia-friendly that I like to think of, and I think we all need to pay attention to that. Number one being accessible. As Jim mentioned, it is important for a community to be safe and inclusive in both their physical structure and their social environment. So for example, from a physical perspective, a dementia-friendly spaces are ideally well lit with clear signage. Quieter spaces are provided to facilitate successful communication. And in these spaces, community members are informed of dementia-friendly practices. From a social perspective, having the awareness of the disease and how it works, as well as providing education, such as communication strategies, can help the average community member who may or may not be directly affected by dementia to have a role and play a role in supporting someone living with dementia as they move within their community. Another component of being dementia friendly is active communication and championing. So as Jerry mentioned, continuous communication is quite an element and key to developing a stress-free and smooth environment. It's important to ensure that the unique voices of people living with dementia are heard and that the community members are open to listening, accepting, including, and supporting those voices. People affected by dementia truly have the most important role in creating dementia-friendly communities. Having champions in the community like Jim and Jerry are pivotal in educational work, advocacy, story sharing, supporting others, and creating change. By sharing their lived experiences and connecting with others, they can share their journey and identify the gaps in our healthcare system, in policy, in community services and supports. And together we can work towards addressing those gaps and build communities that are more accessible and inclusive.
Thanks, Anna. So now that we've shared kind of your perspectives of what dementia-friendly communities mean to each of you, I'm thinking that those in our audience today are probably curious about what they might be able to do to support the creation of a dementia-friendly British Columbia. And so, Jim, I'm going to turn it back to you and say, how can folks in our audience today, how might they be able to support the creation of a dementia-friendly community? As someone living with dementia, what are your thoughts?
Well, they can be an ally and they can learn about dementia. I cannot stress that enough. Access resources like the Canadian Charter of Rights for People with Dementia, the Alzheimer Society of BC website, and the www.flippingstigma.com toolkit. If a group of friends got together for coffee before one of the members was diagnosed with dementia, continue to include that person. Dr. Jason Karlowicz, a physician and writer at the University of Pennsylvania, wrote earlier this year, "Stigma haunts Alzheimer's disease like ghosts haunt Halloween. Oftentimes, it will lead them to not tell other people the diagnosis because they don't want to be treated differently. So I ask you to please don't be that person or community." You know, a few years ago, the Alzheimer's Society had a campaign, #StillHere, that reinforced that people living with dementia are in the community, are functioning in the community and contributing, which is a lesson an acquaintance of mine realized hasn't been adopted by everyone. For years and years, this gentleman used to run men's night at his golf club. He knew all the rules and handled the money. The day after club members were told of his Alzheimer's diagnosis, they stopped asking him about a rule. And he no longer looked after the money. or anything else for that matter. It's so obvious, he said, that people are assuming incapability. And that assumption of incapability will inhibit community members from throwing their support behind dementia-friendly initiatives. What I believe is there can't or won't be support if a friend, a store clerk, or care aide, or even a family member doesn't know what it is they're supporting or how they can support. And that's where the community comes in. They can show their support. They can illustrate their commitment to inclusion by inviting and acknowledging the voices of people living with dementia and highlighting the value of hearing and listening. For example, inviting those in the community living with dementia to provide input on their neighborhoods outside public spaces and facilities being accessible and dementia-friendly. I guarantee there will be many aha moments. It's also important to note that different people will look for different community supports as they find the need. As an example, a woman in my community received her diagnosis of dementia from her doctor and returned home and shut the door. Literally shut the door. Didn't tell a soul of her diagnosis, including her daughter. She only went out her front door when absolutely necessary and otherwise blocked herself off. The turning point for her was receiving an Alzheimer's Society newsletter that included a small item and accompanying photo about something I had participated in. She thought, you know what, if he can do this, so can I. And she started attending my support group. To be an ally is so very important. To be inclusive and listen is vital. To be reassuring to your friend or colleague by inviting and including them as you did before is cherished. And to take the time to learn about dementia is time not wasted.
Thank you, Jim. Some really insightful points there that you've shared with us. And so over to you, Jerry, as the care partner of someone who is living with dementia. What would support the creation of a dementia-friendly community as a care partner?
You know, like Jim, I think the concept of dementia-friendly communities fit with the current international and national legislation, including the United Nations Convention on the Rights of Persons with Disabilities and Canada's Bill C-81, which is called the Accessible Canada Act. In essence, they reflect the importance of removing any and all barriers that prevent any person's full and equal participation in society. We all can look to these frameworks for guidance in developing our dementia-friendly community missions or policies and programs, and built into any framework should be an evaluation component with the measurement tools to determine the success of our developing strategies and whether they've met the desired outcomes or not. As we age, our well-being depends on a broad range of interconnecting factors that are an accumulation of a lifetime of experience, effects, and outcomes. Each dementia journey is unique. It is essential that we develop approaches to our policy and programs that reflect this diversity. And education and knowledge are key in our efforts to enhance the quality of life for the individual diagnosed with dementia and their caregivers and families. You know, currently there seems to be more focus in organizations and with service providers and businesses to practice good governance with the development of 3 to 5 year strategic plans. This is an excellent opportunity to reflect the mission of full and equal participation, as well as value statements that should include dignity, autonomy, safety and security, accommodation and fairness, and the recognition of the right to self-determination. A greater emphasis must be placed on advocacy and education of the public at large, social organizations, religious centers, and educational institutions so that they can refer their contacts and their members appropriately to dementia information sources and the supportive programs and services which will really help them in living life as fully as possible. Currently, the Alzheimer's Society of BC has an annual Breakfast to Remember and the annual Walk for Memories. These are ideal ways to enhance the knowledge and understanding of dementia and to garner the financial and other supports for further programs, research, advocacy, and education. We all must be a part of and encourage these activities and spread the word. In 2004, my husband Peter was the honoree for the walk in Victoria here and took it to heart. He negotiated with the Navy to come with the maiden band and all the sailors that were available. It was a cold but terrific morning in January, and the public were walking to the music of the band for the cause. The walk and the breakfast provides the opportunity to bring together all the sectors in support of dementia-friendly communities. Not only in BC, but I think throughout our nation and even the world. I see this as a kind of a world event in some sort of ways. And we want partnerships in action for a community development model. And we can't underestimate the importance of leadership at all levels of government and in communities to ensure that our policies and programs are dementia inclusive. All the sectors could be included in partnership initiatives and collaboration. And a key element to this is the inclusion and consultation with persons with dementia and their caregivers as a part of the planning of any policy or program. Government ministries and social planners must do more to integrate self-care and mutual aid into any health and social transformation strategy. These programs need innovative designs to overcome barriers to access, such as touch telephone, home videos, computer supports, and all of these should be universally accessible. These tools have also been proven to reduce the caregiver's perceived burden of stress and care. The benefits of self-care and mutual aid strategies for persons with dementia have been shown to improve the quality of life through the promotion of more active participation with online connections and support groups, activity centers for physical and social interaction, and a lot of community programs now that are artistic and musical in an endeavor to participate and to enhance the quality of life for people who really have had in their past so much relationship to the artistic and musical components. And I've spoken now about the formal ways we have to develop dementia-friendly communities. I just want to say I've had an experience with a more organic form when my Peter was in an early stage support group. And I used to wait in the lobby while he had his meeting, and then I would drive him home. And before I realized that there were other drivers also sitting in the lobby, I suddenly noticed that the spontaneous conversations about where to find resources, what to do about certain issues, how could we help? And I thought, we have a lobby support group. And so over the weeks of the length of time that our partners were in the early stage group, the lobby support group went about finding ways to accommodate and to support and to assist. And we stayed together for many months after we actually formed our organic support group. And although the Alzheimer's Society wanted to know more about it, and I think they would like to have formalized it, we insisted that we were doing just fine with each person taking leadership as they felt so inclined. So it happens, and the supports come if we just allow ourselves to be open and allow ourselves to feel that we have a part to play in making our community dementia friendly.
Thank you, Jerry. A lovely illustration of that. It doesn't always have to be formal supports with the ideas of dementia friendly. And so, Santa, over to you, just for some reflection for you as someone who works quite closely with businesses and organizations and municipalities. How do we put into action some of these supports that both Jerry and Jim have alluded to in their comments?
It's a great question, Heather. Thank you, Jim and Jerry, for sharing your thoughts on this. Both of you have beautifully highlighted the critical importance of building dementia-friendly communities. The Dementia Friendly Communities Initiative at the Alzheimer's Society of BC strives to create awareness, bust myths and misconceptions associated with dementia, and support the public and sectors to learn and understand what they can do to make a difference in their communities or spaces and how they can contribute to becoming more dementia friendly. I cannot emphasize enough, just like Jim said, that we all have a role to play, to be an ally, a committed listener, practice good governance, and create community partnerships wherever we may be. We know that at least 60% of people continue to live at home in their communities after a dementia diagnosis. As both Jim and Jerry mentioned, oftentimes people affected by dementia feel neglected and removed from their surroundings because of the misconceptions about the disease, people's lack of knowledge and awareness of how to help, and the fear and denial of the disease. Often people at all levels think of dementia as a medical situation, when in fact it's not only a medical issue, but it's a social concern. One of the ways in which we raise awareness is through dementia education, where community members are educated about dementia and know that a person living with dementia may sometimes experience the world differently. Community members who are dementia friendly know a person living with dementia is more than their diagnosis, understand dementia can affect a person's cognition, behavior, emotions, and physical capabilities, and recognize the signs of dementia and know how to communicate effectively and respectfully. At the Alzheimer's Society of BC, we have found that dementia-friendly communities initiatives are most successful when we build on the strengths of programs that already exist. For example, think of all the age-friendly initiatives in the province and all the work underway on accessibility. To elaborate, an age-friendly lens may identify the need for more seating in a park. A dementia-friendly lens would recommend that the design of the seating is not ambiguous or abstract, that a seat actually looks like a seat, not an art installation, so that the seat may actually represent its use and not cause confusion to someone living with dementia who may have changes in abstract thinking. Now, going back to your question, Heather, we partner and build relationships with municipalities across British Columbia to identify what a dementia-friendly city or space means for them, keeping the learnings from our champions in the forefront. And we support them in achieving their goals through policy and education. In some municipalities, that entails creating a dementia-friendly action plan, which is a step-by-step guide or a commitment in ways that they will work towards becoming more dementia-friendly. For some other municipalities, it's being a part of their accessibility strategy or other advisory committees to represent and advocate for the voices of lived experiences. Across the board, we aspire to educate and build awareness of dementia to all groups and services. And some examples of the kind of work that we continue to do in the community includes training, for example, to tax departments, libraries, recreation centers, neighborhood houses, restaurants, police, first responders, RCMP. And the list is long and it has to become even longer. But really, at the end, the goal is of reducing stigma, raising awareness so people know how to support and can be an equal partner in becoming more dementia friendly. Now, I notice that my time here has almost come to an end. And at the end, before I pass over the mic to Heather, I want to say thank you to our audience, to our participants today for joining us in today's session. Being in this audience today means you're already a supporter of age and dementia-friendly communities. It means you care and you have an interest and an openness to learn. I hope that in this short time, we have been able to give you a glimpse of what it means to be dementia-friendly at its core. Yes, there is more work to be done, but we are so fortunate to be guided by champions like Jim and Jerry, who dedicate so much of their time to building inclusive and supportive communities. I encourage each of you to take the step and learn about dementia. Know that the Alzheimer's Society of BC's website is a treasure trove of further information, including resources for people living with dementia, for care partners, for members of the community, and other sectors. Please feel free to connect with me at any time to learn more, share ideas, or brainstorm ways in which you can support your community and develop this initiative. Building a dementia-friendly province is a movement, and it will require a culture change. And we have heard loud and clear that now is the time. Together, we're ready, and we're committed to making British Columbia more dementia-friendly. Over to you, Heather.
Thanks, Sana. So thank you to Jim and Jerry and Sana. Those are really big questions that we posed to you today, and trying to condense them into a 5-minute window or response is difficult. But there are some common threads that run through what Jim, Jerry, and Sana said today. And while the uniqueness of the disease means that different people living with dementia and their care partners require different supports, what is common to all is the stigma that continues to surround dementia. And yet individuals living with dementia, like Jim and Jerry's late husband, Peter, have the right to enjoy all that we as individuals living without dementia enjoy. So the freedom of movement within our community, the company and enjoyment of good friends, ready communication with those who we encounter when out and about during our daily lives, accessible grocery stores, banks, and other businesses that have quiet areas, clear signage, and staff who know how to communicate with someone with cognitive impairment. It's really about all of us working from a strength-based approach to empower individuals living with dementia. As Jim noted, it's about assuming capability rather than incapability. And it's municipal election time here in British Columbia. So think about approaching your local politicians and asking them what they're doing to support the inclusion of individuals living with dementia and age and dementia-friendly approaches within the community. But also reach out to your neighbors and friends. Talk to your colleagues about what you've heard here today and spread the word. Be an ally and be an advocate. And above all, be inclusive. Reach out to connect with those who you know may be living with dementia and invite them to share their experiences, their needs, their wishes, so that you can support them in their journey.